From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday tonight. Thank you so much for joining us here on News Channel 5 Plus. I'm Carrie Sharp. Tonight's topic, we are talking about sleep apnea and why you may want to go visit your dentist if you are suffering from sleep apnea. I have Dr. Leif Swanson here with me tonight. Dr. Swanson, thanks for being here.
Absolutely, my pleasure.
Hopefully we're going to help a lot of people out tonight and educate them as well a little bit, right?
Yeah, definitely. I'm super pumped to be part of something positive, you know, for the viewers out there and informative to try to help them get some relief.
Sleep apnea is a big problem for folks. Can you kind of give us the broad look at what exactly it is?
So sleep apnea is basically when people are going to sleep and they're laying down at night, some of the muscles in our throat will get almost flaccid, if you will, and collapse. And when they collapse, people can't get air down into their lungs to be able to breathe at night. This can be caused through a couple different ways, you know. As we notice obesity rising in our population, the oversized neck can affect, you know, that airway, and also you know, inflammation, either if it's inflammation from allergies or inflammation from certain type of foods, can also cause, you know, a constriction in that airway as well. So we have either obstructive sleep apnea, which, you know, it's the airway basically closing from either, you know, too much limp tissue or too much weight in the neck, or central sleep apnea, which is more a neuro, you know, muscular thing, and that is obviously out of the dentist realm. So we're mostly treating the obstructive sleep apnea.
Most people have heard of a CPAP machine. You know, you put the mask on and there are tubes coming out of it. There is an alternative, and that is what you're here to talk about today. I had not heard of this.
Yeah, that's exactly why I'm here before. It's nice when you have patients come in and they're like, you know, I've tried to use a CPAP, and, you know, either my spouse or significant other don't like the noise that it makes, or it's just cumbersome. Yeah, the look, or it's cumbersome, or some people get even claustrophobia with it. And people that have latex allergies, you know, can't wear the CPAP. So we're finding that probably almost 50 to 60% of the people that are wearing the CPAP just become non-compliant with it over a year. And as time goes on and there's more tedious, you know, cleaning and maintenance stuff, you start to see the compliance rate start to fall off.
And then you're back to square one.
Yeah.
And if you don't treat sleep apnea, some very serious things health-wise can happen.
Absolutely. We're correlating it with the blood pressure is a big thing, especially diabetes. People wake up and they're just, you know, it's chronic fatigue. Yeah. It's just a cascade of a lot of certain diseases that spiral off of that. And, you know, it's sad to see even younger adults, you know, start to suffer from, you know, blood pressure. You know, we have people that even get gastric reflux from it, because as their airway closes, their diaphragm wants to do what we call paradoxal breathing, so it's pushing that stomach and pushing, you know, the acid up into their throat. And so we as dentists have noticed that for a while. Even grinding of the teeth, we see that, you know, through oral exams, to where, you know, patients, when they're grinding, they clench their neck to try to open the airway up while they're asleep. So there's lots of problems that stem off of the airway.
So when people reach out to you, you have this solution called an oral appliance. Is that the you know, the official name, oral appliance?
Well, it is an oral appliance, and I guess you could say that's the name. But the great thing about it is it's really kind of like orthodontic appliance.
It kind of looks like a retainer.
It does.
Right?
It looks like a retainer. And with this one, you know, after oral examinations, you know, we have to decide on what's best for the patient. depending on, you know, how their bite is, how many teeth they have. But the nice thing about it is, all it does is just simply position their lower jaw out a little bit more to kind of give us space in the neck. So basically what I like to use the analogy of is unkink that little hose or the airway there. So we're just basically taking and opening the you know, the mouth a little bit and unkinking the airway by moving the lower jaw forward.
So just by having these plastic pieces in here, which I'm sure are made to fit through different fittings here, it pulls the bottom part of the jaw forward? How does it work?
So when you close down, these wings right here will actually position the jaw so you can't come forward. So it kind of just, obviously, it actually makes you position the jaw a little bit forward. And we can actually titrate it to where we can, you know, if patients are having like some TMJ issues with it, we can back that off. Or if they feel like, you know, their spouse is like, hey, you know, you're still snoring pretty loud, we can actually move it a little bit more forward so we can kind of take that out. But a lot of the stuff when we first set it is pretty close once you get the appliance. So, you know, sometimes they have to come back for a couple times for us to make little adjustments on it, and actually the patient can even do adjustments by themselves.
So how does this all get started? Walk me through the process. Someone might come in and say, I have sleep apnea, or I'm just tired all the time. Let's start there.
Yeah.
So walk me through the process.
Here's what I suggest to the viewers out there is, you know, if you think that you have the possibility of having sleep apnea, first of all, there's all kinds of tests on the internet. There's an Epworth sleepiness test. There's a Bang test. There's all kinds of different tests, and it'll let you know if you answer so many of these questions. You know, it's like, hey, you know, maybe you needed to go home and make a call and do a sleep study. The interesting thing in our office is that we actually have, instead of going into a clinic in the hospital, you can actually do a take-home sleep study, and you go home with it, and it's basically just like putting a headband around your head.
Okay.
There's little cannulas that hook up around your nose. It's really, it's not so cumbersome, so you can actually get some rest.
You see these sleep studies, and people have, you know, the
all
little electrodes like all over them. And how are they going to sleep? And you're sleeping somewhere foreign, and people are watching or whatever. It's just weird.
Yeah. So you can take this home with you, and you know, it's easy to put together. It's really simple. Comes with some instructions, and we always have somebody online in case, you know, there is issues, and you can even go online and check out the instructions as well. But as soon as you're done, you bring it back to my office or another location, and we can just basically take a chip out of it. We can download it onto the computer. Sometimes I'll send it in to another medical doctor and have him read it, and we can diagnose it right there and within a couple of days. And within a couple of days, we can make another examination where we do a consultation and say, this is what we can do for you. We feel like you're a candidate, and we can figure out which appliance would be the best for you as well.
Very cool. Okay, we have to take a quick break. We're going to pick back up when we come back. I do want to remind you, this is Medical Monday. It is your chance to call in, ask questions. If you have sleep apnea, I know you have questions about how you can feel better, how you can manage this better. This is the night to call. 615-737-PLUS is the number. We're coming right back after this.